Assalamu alaikum wa rahmatullahi wa barakatuh. Alhamdulillah, we are back from our break and ready to resume our conference, inshallah. Allah subhanahu wa ta'ala says in the Quran, and of his signs is that he created for you from yourselves mates that you may find tranquility in them. And he placed between you affection and mercy. Indeed, in that are signs for a people who give thought. This is the beautiful description of the relationship between spouses that has been provided in the Quran. But how will you deal with your spouse if they are going through depression? Will you be harsh, or will you know how to take control yourself and take care of your spouse as well? To deal with such a sensitive issue that can have a bearing on one's marriage itself, we have Brother Usman Mughni to guide us on helping the spouse with depression. Brother Usman Mughni is the founder of and primary therapist at Peaceful You Counseling. He is a licensed marriage and family therapist and is qualified to diagnose and treat anxiety, depression, addiction, and other mental health struggles. Brother Usman also does marriage and premarital counseling along with family counseling and has a child specialist on staff for issues with younger children. He sees patients via Skype as well as in his office in Dallas, Texas. Along with a formal education in therapy, he also has studied under different Islamic scholars and implements Islamic principles into his therapy. MashaAllah. We are truly fortunate to have an expert like him on board today, and so let us now pass the mic to him without any further delay. Brother Usman, welcome and please go ahead.
Jazakumullah khair for that introduction. Bismillahi wassalatu wassalamu ala Rasulullahi sallallahu alayhi wa sallam. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatan min lisani yafqahu qawli. Just first want to make sure you can hear, inshallah.
Yes, brother, we can hear you very clearly.
Okay, perfect. Wonderful. All right, so as the sister had mentioned, my name is Usman Mughni. I am a licensed marriage and family therapist located in Dallas, Texas. And I was given the opportunity to speak about helping your spouse deal with depression. And actually, I'm going to cover not just depression, but anxiety and other mental health struggles that our families may be struggling with. Alhamdulillah, this is a topic which I'm very passionate about. And it's actually one of the things that I have quite a bit of experience in. So prior to going into private practice, I worked at a few different hospitals. Alhamdulillah, I had the opportunity to work at some of the largest behavioral health hospitals in the country. And my role in the hospital was actually as the family therapist. So after diagnosing a patient with, let's say, depression or addiction, or sometimes even the more difficult mental health challenges like bipolar or schizoaffective disorder or schizophrenia, my role would be to meet with the family as well. And not only did I work on treating the patient, but I would also simultaneously treat the family. And what that meant was helping the family to help the patient and seeing how the depression was related to family interactions and how it could be cured by family interactions as well. Because we don't live in a vacuum. What I mean by that is that it's not just a depression alone, but it's interactions sometimes between family members which can make the depression or anxiety or whatever else the mental health struggle is better or worse. So I want to start off just by sharing a few general statistics on mental health, right? It's just important to know because I have so many patients which come to my office and they think that their case is just unique and they feel so bad about it. They say that, I feel like there's something wrong with my iman. I feel that, maybe I don't pray enough. Maybe Allah's punishing me. And I have to share with them that, this is a very, very common problem. And as we'll learn, if you get anything out of this lecture, we'll learn that depression, anxiety, these are medical diseases. So it has nothing to do with one's iman. In fact, it's, to say that, and then unfortunately, sometimes people will erroneously say this. They'll say that, if you prayed more, if you had more taqwa, if you had more tawakkul in Allah, then you wouldn't be going through this. Well, no, that's simply not true. Because you wouldn't say the same thing for somebody with diabetes or somebody with cancer. You wouldn't say, you know what, If you prayed more, you wouldn't have diabetes. If you prayed more, you wouldn't have cancer. So in the same way, we don't say this about somebody struggling with depression or anxiety or bipolar or schizophrenia or whatever other mental health challenges they may be having. So 350 million people a year suffer from depression, and this is major depressive disorder. This is a type of depression that actually stops them from doing day-to-day activities. 7.3% of the world population struggle with anxiety. There's over 60 million people a year which are diagnosed with bipolar disorder, 21 million people a year diagnosed with schizophrenia. So this is by no means a small problem. This is by no means a small problem. And sometimes when people hear this, they start to realize that, okay, it's not just me. This is a real issue. I put a quote of a famous neurobiologist out in Stanford University. Some of you are familiar with Stanford University. It's one of the top research universities in the world, Dr. Robert Sapolsky. And I really like his approach because he approaches it from a very straightforward scientific perspective. And if any of you visit our Facebook page, that's Peaceful You Counseling and Therapy Services, I put up a lecture on depression that Dr. Sapolsky had given a few years back. And he says that depression is as real of a disease as diabetes. Depression is as real of a disease as diabetes. And so he proved that the same, changes which happen to the body in diabetes, there's similar chemical changes which happen to the brain in depression. So it's not necessarily a matter of choice or a matter of willpower, or if you just stay optimistic, you can get over it. No, this is a real disease. So one of the reasons that I actually went into this field, and this is something which I, when we speak with spouses which, or family members which have, a family member struggling with one of these type of mental health illnesses, we remind them that we as an ummah, the Muslim ummah, we were the ones which founded psychiatry. It was us. And yet, unfortunately, now we are the least open to go for mental health help. We are the most, unfortunately, judgmental at times. We stigmatize it more, but that's going against our own history. And so, then this is something well recognized even in the Western world. The first psychiatric hospital was built in the year 705. SubhanAllah. It was our ummah which recognized mental illness as a real thing. It was our ummah which recognized that these people deserve to live a humane life. And so at that time, the physicians were not very well trained in understanding exactly the neurochemical processes which go into depression and anxiety and schizophrenia and these type of things. But they wanted these Muslims under their care, which were struggling with this illness, to live with dignity. And so they built this hospital. Just about a century or so later, there's a wonderful book. It's actually translated into English by a Muslim scientist, a Muslim physician, Abu Zayd al-Balkhi, and he wrote a book. It's a translation of different volumes of. He wrote about diseases of the nafs, but then he also wrote about diseases of the body, and in it he spoke about depression. He spoke about anxiety, and to this day, Western scholars, Western psychiatrists and mental health professionals, which refer to his works, look at it and say, he is the one which actually, some of the techniques which in the 8th, 9th century he was talking about, we use today in our clinic. So this was the legacy of our ummah. He's the one which actually founded some of the principles of cognitive behavioral therapy. I bring this point up just to show, unfortunately, how far we've strayed from this legacy of ours, from understanding that mental health, this is a medical issue, from understanding that we as an ummah have a responsibility to show mercy to those struggling with it, be it our family members, our community members, our neighbors, whoever it may be. So may Allah Azza wa Jal, inshallah, bring us back to that care and concern and that progression that we had as an ummah, which unfortunately we lost. So a marriage and family therapist, my license, we look at any type of mental health disease as a family disease, right? And so we see, and I liken this to the hadith of the Prophet ﷺ, and I have this up here, An-Nu'man ibn Bashir radiallahu anhu. The Prophet ﷺ said that the example or the parable of believers in their affection and their mercy and their compassion for each other is that of a body, is that like one body. When any limb aches, the whole body reacts with sleeplessness. It stays up the whole night and in fever, right? We all know this hadith. We're all very familiar with this hadith, but for some reason or another, when it comes to our family members, right, this hadith goes out the window. The reality is that if we truly care for somebody, if our family members, if our community members are struggling, are in pain, do feel isolated, then we also should feel that pain. And this is an indication of our iman. And the less pain and less concern we feel, we should be worried about this is a deficiency in our iman. And the more care and the more concern we have, then inshallah this is a sign that our heart is still alive. So in the 1950s in America, what we started to realize is that when we were admitting patients into the hospital for some of these severe mental health illnesses, we would treat them, we would medicate them, and then we would send them back home. And a few weeks later, they would come back to the hospital again. And then we would treat them, we would medicate them, and we'd send them back home. And a few weeks later, we'd find them back in that same hospital. So in the 50s, a group of psychiatrists decided to look into this and say, what's going on at home? And so believe it or not, there was actually a period where they would actually admit the entire family. And so along with the patient, the family would stay in the hospital. And they would work together as a family unit to help the patient, to see how can we help this person get out of the depression? How can we help them get out of whatever struggle that they're going through? And so this gave a very, very clear message that it's not just the individual alone, but we have to treat the whole family. Systems theory, which is the theory which is founded from marriage and family therapy, it calls for a change in family interactions, not just the patient. It's not just about one person, but it's about changing the interactions between the husband and wife, or between the children and the parents, or between the mother and the son, or the father and the son, or whatever family interactions there may be. So first, let's go through some very basic tips on how to support your spouse, right? Whether they have some type of mental, illness or not, we all go through some type of difficulty. It's normal for all of us to go through some type of depression, right? Rasul sallallahu alaihi wasallam, he went through sad periods in his life, In one of the classes that I teach, I shared about, how the Prophet sallallahu alaihi wasallam reacted when he lost his son Ibrahim, right? And so the Prophet ﷺ's son died at a very young age. And so when the Prophet ﷺ, saw his son and was washing the body, and he began to cry. And so one of the companions said, even you, Rasulullah, even you cry. And so the Prophet ﷺ reminded him that this is mercy. The ability to show sadness, the ability to cry, this is mercy. And he reminded us that, the heart feels the pain and the eyes shed tears, but we only say that which is pleasing to Allah. And then he made dua for his son. We all go through difficulties in life, whether it leads to an actual diagnosable mental health illness or not. We all go through this, and your ability to support your spouse through these difficult times can really build that connection between you two. And your inability to do that sometimes can cause damage which is very difficult to repair. We each have our own ways of dealing with difficulties, okay? So don't assume that what works for you will work for somebody else, right? So for example, your wife is struggling with depression, or your husband is struggling with depression, and you think, well, the last time that I was sad, what really helped me was distracting myself, or really helped me was reading Quran at that time, or what really helped me was going for a walk. Okay, that worked for you, but it might not necessarily work for them, right? So don't assume that what works for you will automatically work for the other person. Rather, encourage the other person to find out what works for them. So how do you do that? You can say things like, SubhanAllah, I'm sorry, I can't imagine how difficult this is for you. What can I do to help? What do you need right now? Instead of getting into this mode of, let me try and fix you, you have the person encourage them to try and figure out, okay, this is what I need right now. This is what helps me. This is what hurts me. This is what I need to hear from you right now. This is not what I need to hear from you right now. And if they don't know at the moment, give them some time to think about it. That's okay. We'll figure it out. Take a few minutes, take a few hours, take a day or so, but figure out what you need, and I'm there for you. Identify if your spouse is a problem-solving type person or an understanding first type person. So these are terms that I use in when I do marriage therapy. What this is referring to is this concept that we have different ways of navigating through life, okay? Some of us, when we're faced with difficulty, we need a solution, okay? For example, if somebody, and may Allah Azza wa Jal, protect us and always give us rizq, halal rizq, you lose your job, right? Now, some of us are problem-solving first people. So when we lose our jobs or when we're going through some type of financial difficulty, we don't need to hear from our spouses, hey, everything will be okay, don't worry, it'll be fine, I'm sorry you're going through this. That's not the most helpful thing. What's helpful at that point is help me find another job. Look at my resume. Let's solve this pragmatically. Let's, talk to people which might be hiring. That's what gives me comfort. Other people are understanding first people, okay? Now, these type of people, when they're going through a difficulty, they say, look, I don't need you to just throw solutions at me immediately. Understand where I'm coming from first, okay? So if I'm sad, empathize with me for a minute. At least acknowledge that what I'm going through is real. At least acknowledge the pain that I'm in right now. And once I feel understood, once I feel that you know where I'm coming from, you understand the pain I'm in, then I'm ready to problem solve. So you have to identify or help your spouse identify, are they problem solving first or are they understanding first? Do they need a solution? Do they just need to be understood, right? And understanding first people, once they're understood, then they're ready to problem solve. So again, don't assume that just because I'm problem solving and I have solutions and what helps me is getting solutions, that your spouse immediately needs solutions. Oh, do this, remember Allah, do this, do that. Those reminders are fine, but at the moment, what do they need? If they just need understanding first, then give them that understanding. The way you respond to a partner when they are stressed can really help or hurt the relationship. Understand that when your spouse is going through depression, it's not something easy to discuss. And when they share with you, it's an amana, it's a trust. And they're saying, I'm trusting you with this insecurity, this weakness that I feel in myself, right? Although it's not a weakness, but for the person which is depressed, they feel like this. They're trusting that you are empathetic, that you understand. And the most hurtful thing is that after they share this with you, if they feel like, this person rejected me over and over again, or he insulted me, or he made me feel like it's a weakness, that not only damages the person, but it damages the relationship as well. But if you're able to respond and say, you know what, I'm there for you, then when your spouse is able to get out of the depression, is able to get out of the anxiety, is able to work through it, then this only makes your marriage stronger. So let's talk first about depression. Unfortunately, I have heard khutbahs in the past, and I've had a lot of my patients complain to me as well that we keep getting the message from our communities that it's because of our iman. If we had more tawakkul, we wouldn't be depressed. If we had more, if we prayed more, if we were closer to Allah, or if we trusted Allah more, then we wouldn't be as depressed. Again, depression is not related to one's iman. So before I became a therapist, my background was actually in diagnostic medical imaging, in radiology. And so now we have the technology where we can actually show somebody's brain live feed on a functional MRI machine. And I can actually pinpoint you and show you, there's your depression right there on the screen. It's not made up. It has nothing to do with your iman. That area of the brain right there, which is being activated or is not able to be activated, that's your depression right there. You can touch it. It's right there. So depression is not related to one's iman. It's a medical disease, and we have to start seeing it as such because it doesn't help. Now, yes, bringing yourself closer to Allah Azza wa Jal, asking Allah Azza wa Jal for help, praying more, these type of things help in getting out of depression, but when you are diagnosed with depression, it has nothing to do with your iman. I've had some of the most righteous people, people which are very, very close to Allah Azza wa Jal, people which are, Hafidh al-Quran, struggling with this. And believe me, it has nothing to do with their iman. The second thing is that you don't just get over it. Depression sometimes can be a lifelong disease, It's something which you need to be patient with the other person. It can be frustrating, and one of the things that I actually tell people which have a family member which is struggling with this is that they need to learn to take care of themselves, right? So that they continue to have patience. You take care of yourself. If your spouse is struggling with depression, make sure that you're doing okay, that you have leisure time, that you're exercising, that you're taking care of yourself, that you have somebody to talk to as well, right? Because it can be overwhelming every day to try and help your spouse with this. But you want to have that patience so that you're able to recognize that it's not just something you just snap out of it. Just don't be sad. Think of positive things, you'll be fine. It's not that easy. If it was that easy, I'd be out of work and all the hospitals would be closed down. But we realize, unfortunately, it's not that easy. It's, again, as real of a disease as diabetes. And we don't tell a diabetic, listen, just get over it. If you think positively and you fear Allah, then your pancreas is going to change. All of a sudden, it'll start producing insulin. Don't worry. That's not the way we approach diabetes, and it shouldn't be the way that we approach depression. Get professional help when needed. Okay. If we start to see it as a medical disease, then we'll be quicker at getting the help when we need it, because sometimes untreated depression can lead to even worse depression. The longer you wait, the more difficult it is to get out of it. Sometimes it can lead to things like suicidal ideation. And when I say professional help, I mean go to somebody which is licensed, which recognizes these things. We have, unfortunately, a problem in the United States. I'm not sure if this is the same with other countries, where we expect our poor imams, unfortunately, to wear multiple hats, And sometimes this is due to limited resources, but I don't think this is, at least in the US, no longer the case. We have, alhamdulillah, a good amount of mental health professionals, alhamdulillah. Go to somebody which actually knows how to diagnose and treat this. Okay. Recognize the signs and symptoms of clinical depression. Okay. So it's not just, oh, I feel sad, I feel down right now. It's an overwhelming amount of sadness. There's hopelessness, guilt. Sometimes people struggling with depression, they even have difficulty focusing. They have difficulty remembering things of the past. If they're memorizing Quran, or if they're in school or they're working, they sometimes forget what they've already learned. They might start to find themselves thinking very slowly. One of the worst symptoms, actually, in depression is something known as anhedonia. What anhedonia is it's actually the opposite of hedonism. If people know what hedonism is, hedonism is this idea of being overly engaged in pleasure, right? You say somebody is being hedonistic if they are just only concerned about the bodily pleasures, just eating and drinking and fornicating and doing this and doing that. And this is, of course, something far away from our religion. Our religion is a balanced religion. Anhedonia is on the other side. Anhedonia is the inability to have pleasure in things you used to enjoy before. Before, I used to enjoy going out with friends. Now I just don't want to anymore. I can't see myself laughing anymore. I used to enjoy going to the masjid. I don't anymore. I used to enjoy, going out for walks. I can't get out of bed anymore. Anhedonia is the inability to deal with pleasure, to feel pleasure. And with this combined with hopelessness, depression can become a very, very scary disease, because with other diseases, you have this outlook that maybe if I take this medication, maybe if I do this, I will start to get better. There's that hope. Depression, unfortunately, at its worst stages, takes away that hope completely. And you find yourself a completely different person, and then you just remember, oh, I used to be so happy before, and now I can't feel anything. And so, I mean, just to give you an idea as to how difficult life can be for somebody struggling with clinical depression. There's an extreme amount of lethargy. People sleeping a lot, even after a good night's rest, still feeling tired. One of the very common symptoms, actually, in depression is that no matter how early or how late the person sleeps, they'll wake up early morning and they just find themselves, it's difficult to go back to bed. They'll always wake up early in the morning. There's going to be changes in sleeping and eating. I've heard a lot of my patients just say, I just stopped having an appetite. I'm just so stressed and so down that even food that I used to enjoy before tastes bland. May Allah protect us, but we're starting to see how serious of a disease it is that your body, your brain doesn't allow you to even get the same pleasure that you would in eating. And so you just lose your appetite as well. So no sleep or interrupted sleep, difficulty eating, just loss of appetite, and then at times suicidal ideation. Suicidal ideation is, thoughts of wanting to hurt yourself, thoughts of wanting to, it would be better if, maybe I didn't exist, or maybe, and so one point I want to make on this is that, again, going back to the point of this is not about one's iman. If any of us ever struggle with this idea of suicidal ideation, recognize that it's not a matter of iman. In fact, one of the most righteous women on the face of this earth, Maryam alayhi salam, she felt so sad and down and was going through so much difficulty that in Surah Maryam, she says, alayha salatu wasalam, she says, Ya laytani mittu qabla hadha, that, woe is me, I wish I died before this. Imam Ibn Kathir, rahimahullah, he speaks about how this is an evidence to show that our thoughts, our negative thoughts, we're not held accountable for those. Now, obviously, if Maryam alayhi salam or if any of us were to act on this, then we would be in sin. Then we would be held accountable in front of Allah Azza wa Jal. But before that, just the thought itself, we're not held accountable because Allah Azza wa Jal is a merciful Lord. And so it's very interesting that, Allah Azza wa Jal doesn't respond to Maryam with, pray more or fast more or, fear me more. Who's going to tell Maryam alayhi salam to fear Allah more? She's the most righteous woman to ever walk the face of this earth. And so instead of that, Allah Azza wa Jal addresses her depression, right? What was she going through? She was pregnant, going through the pains of pregnancy. She didn't know how she became pregnant. And on top of that, she's being accused of zina. This woman, which has dedicated her life to Allah Azza wa Jal, is being accused of one of the most horrible acts. And so she feels physical pain, and she feels emotional pain, and she feels psychological pain. And she says, Ya laytani mitu qabla hadha. So Allah Azza wa Jal, He responds to her, He says, Fakuli washrabi wa qarri ayna. Very interesting response. He said, Oh Maryam, eat something, drink something, wa qarri ayna, and bring coolness to your eyes, knowing that I'm there for you. I'm going to look after you. I'm here to protect you. Allah Azza wa Jal is teaching us a lesson here that, when we get this down, go back to the basics. Did you eat something? Because one of the symptoms of depression is loss of appetite. Drink something. Take care of yourself physically right now. I'm not going to hold you accountable for these negative thoughts you're having because you're going through a tough time right now. But after you've ate something, and after you've drank something, and after you've taken care of yourself physically and made sure that, you're in the correct state of mind, then at that point, pleasure. And, with this combined with hopelessness, depression can become a very, very scary disease, because with other diseases, you have this outlook that maybe if I take this medication, maybe if I do this, I will start to get better. There's that hope. Depression, unfortunately, at its worst stages, takes away that hope completely. And you find yourself a completely different person, and then you just remember, oh, I used to be so happy before, and now I can't feel anything. And so, just to give you an idea as to how difficult life can be for somebody struggling with clinical depression, there's an extreme amount of lethargy. people sleeping a lot, even after a good night's rest, still feeling tired. One of the very common symptoms actually in depression is that no matter how early or how late the person sleeps, they'll wake up early morning and they just find themselves, it's difficult to go back to bed. They'll always wake up early in the morning. There's going to be changes in sleeping and eating. I've heard a lot of my patients just say, I just stopped having an appetite. I'm just so stressed and so down that even food that I used to enjoy before tastes bland. May Allah protect us, but we're starting to see how serious of a disease it is that your body, your brain doesn't allow you to even, get the same pleasure that you would in eating. And so you just lose your appetite as well. So no sleep or interrupted sleep, difficulty eating, just loss of appetite, and then at times suicidal ideation. Suicidal ideation is, thoughts of wanting to hurt yourself, thoughts of wanting to, it would be better if, maybe I didn't exist, or maybe, and so one point I want to make on this is that, again, going back to the point of this is not about one's iman. If any of us ever struggle with this idea of suicidal ideation, recognize that it's not a matter of iman. In fact, one of the most righteous women on the face of this earth, Maryam alayhi salam, she felt so sad and down and was going through so much difficulty that in Surah Maryam, she says, alayhi salatu wasalam, she says, Ya laytani mittu qabla hadha, that, woe is me, I wish I died before this. Imam Ibn Kathir, rahimahullah, he speaks about how this is an evidence to show that our thoughts, our negative thoughts, we're not held accountable for those. Now, obviously, if Maryam alayhi salam, or if any of us were to act on this, then we would be in sin. Then we would be held accountable in front of Allah Azza wa Jal. But before that, just the thought itself, we're not held accountable because Allah Azza wa Jal is a merciful Lord. And so it's very interesting that, Allah Azza wa Jal doesn't respond to Maryam with, pray more or fast more or, fear me more. Who's going to tell Maryam alayhi salam to fear Allah more? She's the most righteous woman to ever walk the face of this earth. And so instead of that, Allah Azza wa Jal addresses her depression, right? What was she going through? She was pregnant and going through the pains of pregnancy. She didn't know how she became pregnant. And on top of that, she's being accused of zina. This woman, which has dedicated her life to Allah Azza wa Jal, is being accused of one of the most horrible acts. And so she feels physical pain, and she feels emotional pain, and she feels psychological pain. And she says, Ya laytani mitu qabla hadha. So Allah Azza wa Jal, He responds to her, He says, Fakuli washrabi wa qarri ayna. Very interesting response. He said, Oh Maryam, eat something, drink something, wa qarri ayna, and bring coolness to your eyes, knowing that I'm there for you. I'm going to look after you. I'm here to protect you. Allah Azza wa Jal is teaching us a lesson here that, when we get this down, go back to the basics. Did you eat something? Because one of the symptoms of depression is loss of appetite. Drink something. Take care of yourself physically right now. I'm not going to hold you accountable for these negative thoughts you're having because you're going through a tough time right now. But after you've ate something, and after you've drank something, and after you've taken care of yourself physically and made sure that, you're in a correct state of mind, then at that point, remember that I'm there for you. Bring coolness to your eyes, knowing that even if you feel the whole world has left you, Maryam, I will always be there for you. So your support for your spouse with depression is based on if your spouse is understanding first or problem solving first. And sometimes they might need one or another, right? So the simplest way to find out if your spouse is understanding first or problem solving first is to do what? Is to ask them, how can I help you? What helps you? What type of things do you like to hear? What do you need at that time? If your spouse is understanding first, then you say things like, I can't imagine how difficult this must be for you. I'm sorry you're going through such a tough time, and then you can ask her, what can I do to help? If she's problem solving first, then, or he's problem solving first, because men also go through depression, then you can say, okay, why don't we go out for a walk? How about, did you eat something? Did you drink something? Do you want to take a nap? You kind of encourage them to break out of that pattern, because that's the type of support they're looking for. Show compassion and empathy. Although we've all felt sadness, in one degree or another, it's not to be confused with clinical depression. Clinical depression is something, which is beyond just that general sadness that we feel from time to time. Sometimes the pain that we can't see is worse than the pain we can see, right? So it's unfortunate, but if somebody has a broken leg, everybody will, come to that person's aid. They'll, open the door for that person. Are you okay? Are you, how can we help you? It's time for prayer. Everyone will rush to get that person a chair. But the person going through depression, you can't see that crutch. You can't see those broken bones. You can't see that broken heart, right? And sometimes that can be worse than even, some of the external pain that we can see. And during those times, you have to be sensitive. I had one of my patients once tell me that, he was trying to reach out to some friends and so on. And, he started tearing up, and he said, I don't know, when people don't pick up the phone sometimes, Babe, I get it that they, might be busy, but maybe I'm just, my depression makes me extra sensitive at times. This is the pain that we can't see. Do the opposite of what the depression tells you. Okay, so this is more for the people actually struggling with depression. Okay. If your depression tells you, I'm not in the mood to eat, what are you going to do? Force yourself to eat. If the depression tells you, I want to stay isolated, I just don't feel like going out, I don't feel like seeing anybody, force yourself to go out with friends. Force yourself to go to a supportive environment. I don't feel like going to the masjid, go to the masjid. Your depression lies to you. Your depression wants you to be in that worst state. So do the opposite of what your depression tells you. Use positive reinforcement, right? So as a spouse, when you see the progress, right? So, point that out. Say, Alhamdulillah, you did this, mashallah. I'm so proud of you for doing this. I have a lot of times people which will come to me with major depressive disorder. And these are the people which, are a step away from actually being hospitalized. And what I'll tell them, and then when they say, nothing seems to make this depression go away, it's here forever. I asked them, the first question I asked them, well, how did you come to the office? How did you find the willpower? How did you find the energy and the strength to drive all the way to my office? And, then they say, I don't know, I just was able to. And I said, Alhamdulillah, this is something which is really, really big. And so I'm showing them this positive reinforcement that this act, which you see as small, I mean, if I felt like I had a boulder on me and I couldn't get out of bed, and there's this chemical, process in my brain which is just telling me that I'm worthless and telling me that I shouldn't get out of bed, and I fight that, and I still get in my car and I drive all the way to the clinic and I see the therapist and I open up to them, that's a big deal. So use that positive reinforcement. And another thing that I tell people, and this is again something you can work on with your spouse, or if your spouse is the one listening to this who is going through that depression, I tell them to scale the depression to evaluate progress. So what do I mean by this? Scaling depression basically means you give the depression a number. So I say, pick a number from 0 to 10. 0 being that there's, no depression whatsoever and you're the happiest as possible, and 10 being that it's the absolute worst depression that you've ever faced. And maybe go throughout the day, maybe 2-3 times a day, every day for at least a week. Write down where your depression is, and then come back to me after a week, and let's see how the numbers look. Because somebody who's depressed throughout the week, if they have 1 or 2 bad incidences, they'll only be able to see that negative, right? But if they're able to look back and say, you know what? Okay, Tuesday and Wednesday, I actually had a 5 out of 10, which was, these were good days. Or I had a 4 out of 10. But then Wednesday and Thursday, they were like a 9 out of 10. Then we can actually start to have the discussion about what was done differently. And it gives the person hope that, it's not always bad. There are ups and downs, because that's the nature of depression. Our bodies can't handle having a 10 out of 10 of depression every single day, 24 hours a day. That's just not the way that Allah has created our bodies. Okay, now let's talk about anxiety. Anxiety sometimes is coupled with depression, and anxiety again is more than just worrying, right? If you worry, or oh, I'm getting nervous, okay, just like depression is more than just sadness. We're talking about a clinical problem here. Anxiety is one of the leading causes of ER visits, right? Many times people will go into the ER thinking that they're having a heart attack, thinking that, I can't breathe, and, it's found out that it's an anxiety attack. Now, one thing that I do tell people struggling with anxiety and people which have panic attacks is that, medically speaking, unless you have a pre-existing heart condition, you can't have a heart attack from a panic attack. And you're not going to stop breathing from an anxiety attack. It feels that way, but you can't die from an anxiety attack unless you have a pre-existing medical disease, but then it'll be that thing which harms you, not the actual anxiety itself. So anxiety is where your mind is racing, 100 miles an hour, 100 kilometers an hour. It's telling you and predicting all of the worst things which can happen. People are thinking this about me, and this is going to happen, and if I don't do this. So it's not just worrying, but it's a constant nagging, a constant, your brain is constantly running, and it can get just very, very exhausting. Okay, so how do we support our spouses when we have, anxiety? I mean, obviously, number one, don't say, okay, just stop worrying, because that's, if only it was that easy. Don't enable the anxiety, encourage your partner to challenge it. Don't enable it, meaning that, okay, it's, let them just continue to worry. Rather say, okay, I want you to try and challenge the anxiety. You're worried about this happening. You're worried about finances. You're worried about this. Go back and challenge it. So if you're worried, what are we going to do about, making next month's rent? How many times has Allah Azza wa Jal protected you before? How many times in your life have you thought, subhanAllah, that's it, things are not going to work out, my life is over, and somehow, some way, Allah has protected you. Somehow, some way, you find the money to make the rent. Somehow, some way, things work out. You were so close to a divorce and it didn't happen. You were so close to this health scare, and Allah, gave you good health after that. This happens to us over and over again. And when we take these experiences, right, we can use them to challenge our anxiety. We can say, subhanAllah, I see a pattern. Allah is trying to tell me something. Allah is trying to tell me that I have your back. I'm here to protect you. You just have to believe in me. You just have to look at all the times which I did take care of you. So encourage your partner to challenge that anxiety and think about all the times where Allah has protected us and has taken care of us. This is actually a technique of being able to challenge the negative thoughts in what's known as cognitive behavioral therapy. Cognitive behavioral therapy is one of the forms of therapy that myself and the other therapists that we have on staff that we specialize in. Cognitive behavioral therapy, or CBT, it's actually, research shows it's one of the best and fastest ways to treat anxiety. And alhamdulillah, I've been successfully able to help quite a few patients with their negative thoughts. Count each victory. So what this means is, just as you are positively reinforcing and encouraging the person to get out of depression, count each time that your partner was able to let go of that anxiety. Now, let's suppose, for example, I'll give the example of social anxiety, right? Let's suppose that your partner has anxiety about going out in public or meeting other people. They start to, and again, this is more than just worry. This is, oh my God, what is this person going to think about me? What are they thinking about me right now? Thoughts over and over again, to the point where you physically, you just don't want to go out anymore. Now, if your spouse, decides, okay, I'm going to take a step outside, or I'm going to go shopping. I won't go to the large shopping mall, but I'll go to a small convenience store or something. Count that as a victory, because to them, they went from, staying at home to at least forcing themselves and fighting. And only Allah knows what type of thoughts they're trying to fight to go out. So instead of getting frustrated with them and saying, oh, subhanAllah, that's it, you only went out once this month, say alhamdulillah, you went out once this month, and let's try inshallah for the next time to go out maybe 2-3 times a month. Or subhanallah, last time you spent maybe 2-3 hours worrying about this issue, or a day worrying about this issue, now it was only half a day. Count each victory and stay patient as your partner fights their anxiety. Anxiety and depression are contagious, okay? And if you don't take care of yourself, you're going to find yourself an anxious person. You're going to find yourself a stressed person. You're going to find yourself a depressed person, okay? Our job as spouses is not to be therapists. We don't have to cure their anxiety. We don't have to cure their depression, right? That's what professionals are for. But we have to stay patient. That's our job. We have to continue to love them. We have to continue to support them. We have to continue to make dua for them. That's our job. And in order to do that, you have to make sure you're taking care of yourself. This is one of the probably most frequent conversations I have with family members. Especially at the hospital setting, I used to have a lot of conversations with family members starting off with this: what are you doing to take care of yourself? That your spouse is in the hospital right now. What are you doing to take care of yourself? And most of the time the answer I would get is, no, I just want them to get better. And well, that's not going to fix it. You have to take care of yourself first. Ya ayyuhalladhina amanu qu anfusakum wa ahlikum nara. Qu anfusakum awwalan. O you who believe, protect yourselves and your family from the hellfire. Protect yourself first. One of the examples that I give is that of if you're flying on a plane, right? If you're flying on a plane and God forbid the plane is going down, they say that you put the oxygen mask on yourself first, and then your loved ones. And this goes against, if you're a parent, I'm a parent, alhamdulillah. This goes against your natural instinct as a parent. You're saying, wait a minute, my 5-year-old son or daughter is right next to me and the plane is going down, and you want me to worry about myself first? Yes. The reason for that is because if you don't help yourself at that moment and you try and put the oxygen mask on them, in your attempt to help them, you yourself are going to pass out, right? In your attempt to help your partner with their anxiety or their depression or other mental health illness, if you're not taking care of yourself, you're going to be the one hospitalized. So you have to make it a priority to take care of yourself as well. This doesn't mean ignore their needs, but at the same time, learn to make a balance. Protect yourself. Do things which make you happy, obviously in a halal manner. Exercise. Go out for walks. Stay attached to the masjid. Have a social life as well, so that you can continue to support your partner. So support for other mental health illnesses. Okay. So go to a physician or licensed mental health professional first, right? We sometimes have the tendency to immediately assume, that, okay, this is sihr, there's something wrong, or let's go to the imam and so on. And sometimes, these can be, we don't deny that these issues exist, but it's not the reason for everything. There are things like bipolar and schizophrenia, which schizophrenia, if there's any disease which mimics possession, it would be schizophrenia, where you actually have visual and auditory hallucinations and so on. Not everything is sihr. So go to a physician, go to a licensed mental health professional first. Okay, be part of the treatment conversation. So you want to be there with the doctor. I encourage family members to come in and sit and actually speak with me as I'm speaking with the patient. I'd like to see the whole family together so they understand what the patient is going through, and they understand what needs to be done for them to get help. And also it gives them a venue to basically share their frustrations, because it can be difficult at times, right? Especially with those of us which have family members which have severe mental health illnesses. It can be scary at times. Okay, so be part of the treatment conversation. Now, not everything your spouse does is related to their mental illness. Okay, this is a trap that a lot of us fall into. Oh, she's just saying this because she's depressed. He's just saying this because he's anxious. No, there might be times where you did something wrong. There might be times when there was a legitimate argument between you two, and whether the depression was there or not, or whether the anxiety was there or not, your spouse was justified in being upset. So don't make that mistake of putting everything on the mental illness. Oh, they're behaving that way because they're diagnosed with bipolar. It's the bipolar again. No, that's not true. Not everything is that black and white. There are times when legitimately your spouse will have there's times where legitimately your spouse will have complaints which is not related to the mental illness. Encourage medication compliance while using kind words that will remove the stigma. Okay, so this is for the more severe mental health illnesses, and I'm not completely opposed to medication for sometimes even for major depression, right? So what we know as far as medication, number one, this is not the first thing that we encourage. If you can resolve things without this is for anxiety and for depression, not for bipolar and for schizophrenia. For bipolar, for schizophrenia, for schizoaffective disorder, for these type of things, you almost always want to be on a medication. And when I have that conversation with patients, I tell them, look, this is about a chemical imbalance. It's not about your weakness or something like that. Just like I would recommend that somebody take metformin or some type of medication if they have diabetes. The same way I'm, saying that you need to take this daily medication. And on top of that, keep good relations, stay patient, challenge negative thoughts, have a positive environment, continue therapy. But medication is part of that treatment. So as a supportive spouse, you want to encourage the person to continue the medications that they're prescribed, stay compliant to that, but at the same time, use kind words that remove the stigma, not like, oh, you're crazy, that's why you have to take this, but rather, look, mashallah, you're doing such a good job. This is just a supplement, right? I don't look at you any differently because you have to take these medications. A lot of times it's because of what the person perceives that their family members think of them, or that others think of them. Oh, they just think that I'm bimar, I'm crazy, and that's why I have to take these medications. No, make sure you make that clear to your spouse. Look, I don't look at you any differently. I'm very proud of you for going through this. I'm proud of you for being able to have the courage to take these medications daily, right? And if you fall into the pattern of blaming your spouse's mental illness for everything, then of course they're not gonna want to take the medication, because they're gonna think, oh, my husband or my wife just think it's just because of the mental illness that I do these things, so everything is just being blamed on that, and there's no blame on them, and I'm just a patient, I'm just the bad guy here. So you want to make sure that you're very clear with your words, you're very kind with your words, that look, it's not about you, it's not about you being a bad person or something. This is just something, and I don't look at you any less for this, right? With depression and anxiety, so what research shows us, for depression, there's unfortunately not too much research showing that mild to moderate depression that medication does much. For major depression, we do have research showing that medication can help. Okay, but again, all of these things, these are to be determined by a mental health professional, a licensed mental health professional. Okay, again, in our field, we don't always immediately resort to medication. In fact, there's a lot of research showing that just daily exercise and so on can have the same effects as a mild antidepressant. But if your spouse is struggling with that, you want to make sure that they have that they're staying medication compliant. And then finally, engage in self-care. If you show your spouse that look, it's important to take care of yourself, and I'm doing that by example. I'm going out. I have my, that'll encourage them to take care of themselves, and it'll give you that patience. So make a list, and this is something I recommend both for the patient and for the whole family. Make a list of things healthy things which you can do when you're stressed out. What is self-care to you? Is it listening to Quran? Is it going out for a walk? Is it having some tea? Is it eating your favorite food? Is it meeting up with friends? Is it taking a nap? And so you want that list of anytime I'm overwhelmed, anytime I feel stressed out about this current situation, I know step by step what I need to do. I have a list of things that I engage in for self-care. Finally, we want to be not just, this is not just for spouses, but this is for the community members. This is for the ummah as a whole. We want to be an ummah of mercy, right? Abdullah bin Amr radiallahu anhu, he narrated that the Prophet ﷺ said that those who are merciful will be shown mercy by the most merciful. Be merciful to those on earth, and the one in the heavens will have mercy upon you. Ar-Rahimun yarhamuhum ar-Rahman. Yarhamu man fil ard yarhamkum man fis sama. That if you show mercy to those, that just as the Prophet ﷺ showed mercy to those people struggling, the most merciful Ar-Rahman will show mercy to you. And if you show mercy to those people which are struggling in our communities with these type of mental health illnesses, then the Malaika and the inhabitants of the heavens will have mercy on you. So mercy is more than just providing for your spouse. Mercy is more than just giving them their rights. Okay? Marriage is not about just rights and responsibilities, but mercy is going above and beyond that. Mercy is giving understanding. Mercy is being patient with your spouse. Mercy is an act of worship. And finally, I ask people, make dua for your spouse. ربنا هب لنا من أزواجنا وذرياتنا قرة أعين وجعلنا للمتقين إماما. And with that, inshallah, I'll leave it for questions and answers.
Jazakallah khair, Brother Usman. The knowledge you have shared with us has not only been eye-opening, but also very encouraging in the positive direction. MashaAllah. We have a few minutes before we go into a break, so we can take 2 to 3 questions, inshallah. Please type in the question in the chat box and make sure to keep it brief and clear.
How will I see the question? I don't see the chat box. Can you just read off the question to me?
Yes, definitely, brother. The question is, how do you know how to help spouses with post-traumatic stress disorder?
How do you help spouses with post-traumatic stress disorder? Yeah.
Yes.
Okay. So PTSD, or post-traumatic stress disorder. Again, this is something which, number one, formally has to be diagnosed by a licensed mental health professional. Now, with PTSD, right? Again, there are certain symptoms, there are certain triggers, right? So how to help your spouse is to have the conversation, and sometimes this is best actually with a therapist, as to let's suppose, for example, somebody has PTSD from abuse, or God forbid they were sexually assaulted or something like this, right? And so now you want to be able to have that conversation, and sometimes it helps in front of a therapist with your partner as to, okay, what are the things which sometimes trigger you or remind you of that, and what do you need at that moment? What are some things which you're maybe a little bit extra sensitive to, right? Because somebody which is going through post-traumatic stress disorder, one of the common symptoms is that they're very what we call hypervigilant, meaning that they're always on edge about certain things. Some things which we might see as innocuous, some things which we might see as, okay, this is not a big deal, might really scare them. Maybe being in a bad neighborhood, or maybe seeing something which reminds them of the stressful or the traumatic event that triggers them. So we need to be able to have that conversation with, okay, what are your triggers, and then what do you need from me at that moment? How can I be supportive? Now, sometimes, unfortunately, it's the spouse or the relationship itself which is traumatic. And for that case, obviously marriage therapy, the person has to learn how to let go of that trauma. Sometimes that usually isn't PTSD, but that is a reaction to the trauma. So let's suppose there was previous abuse, or there was previous, just like really poor relations, or and that caused mistrust in a relationship. So the spouse has to learn how to rebuild that trust, and then the other spouse, which is going through that trauma, has to learn how to let go of the past and the pain that they're holding on to.
All right. We have a question from Sister Uzma. She says, Assalamu alaikum, brother. How can one help the spouse when he is not accepting that he has severe depression or other mental illness, but himself and his family are not ready to accept and to get any professional help? And this question has been asked by 3 other people as well.
Okay, excellent question. So as a male therapist, I will say this. that it's statistically, for some reason, it's easier for women to acknowledge the fact that, okay, I'm struggling with this, I'm going through depression, because of, unfortunately, our misunderstanding of what depression is. For men, it's perceived as a weakness, you know? And so one of the things that I actually start off with patients is I say, okay, let's not call it depression, you know? So the spouse can say, okay, Tika, we're not, you know, okay, fine, we're not going to call it depression, but how is it affecting you? Are you happy right now? Are you able to sleep properly? Are you able to focus at work? Are you able to work? And if the answer is no, then at least let's get you help for that. Sometimes I have no problem even using the word lethargy. I say, okay, we're not going to call it depression, we're going to call it tiredness. You know, the symptoms are the same, but if you're so afraid of that word depression, we'll call it something else. There's been patients which show clear signs of depression, and I say, okay, you have something, maybe a mild depression known as dysthymia. But, you know, I call it whatever it is, because the point is not what we label it. The point is, how do we treat the symptoms and get the person, you know, back to their normal routine. So instead of just saying, okay, you have depression, you need to go see a therapist, there's something wrong with you, just say, look, are you happy? You know, are you able to function, you know, in your day-to-day life? If not, you know, maybe you can talk to somebody once. What I tell people, you know, when they encourage their family members to come see me, is just to say, look, you know, if you want, just see the therapist once. If you don't feel comfortable after that, it's not a big deal, but just try at least once. You know, what's the harm in that? So try and make it not too big of a deal, if that makes sense, because they already feel sensitive enough that, you know, what were you saying? I have depression. You know, is there something wrong with me? If that makes sense.
Okay, brother, but what if the case that they are not ready to see anyone, whatever that situation may be called, and they just don't want to go to any counselor and they flatly refuse? So within your own home, how can you help them? Is there any way to help them?
Is there any way to help them within your own home? Well, I mean, you know, a person needs to get help themselves. They need to be motivated to get help themselves. You can't force them. If they're truly going through major depression, right? You know, then at that point, and they're absolutely not listening to you, then get other people involved, which, you know, they might listen to. Be it a supportive family member, be it, you know, a supportive member of the community, something. But if they truly have, you know, major depression, if they're just going through, and again, only a professional can really distinguish between these. But you have to stay patient with them, and you have to, you know, remind them that, look, you know, this is not, you know, about labeling you in a bad way or something, but, you know, this can't continue. Obviously, it's harming you. And sometimes, unfortunately, it takes months before the person comes into therapy. And that's the part where you have to be merciful and patient and take care of yourself throughout that process, because you're seeing them destroying themselves, you're seeing them destroy the family. And at that time, you have to take a step back and say, okay, I have children, or I have other family members, and I have to prioritize myself as well. I can only gently remind the person and make dua for them. But at the end of the day, they have to be motivated to come in themselves. So it's a tough situation, because I have had cases like that where sometimes 6 months, a year and a half, sometimes even longer than that, it takes for the person to finally be convinced.
All right, Jazakallah khair, brother. That's all the time we have for this session. Once again, we would like to thank Brother Usman for his time, and we hope that we get to listen to him again sometime soon, inshallah. We are now going into a break for 15 minutes, and we'll be back shortly, inshallah.
Assalamu alaikum.
Alaikum assalam wa rahmatullah.